Our next two speakers, because they're going to do a double act on PAHO and its research agenda for global health diplomacy. Dr. Norka Ruiz, who is an advisor on resource mobilization for research policy at the Pan American Health Organization, and Dr. Lois Cohen, who, appropriate title for this session, is Ambassador for Global Health Research of the Paul G. Rogers Society for Global Health Research in the United States.
We'll give the first part of the presentation, and then my colleague Lois Cohen will follow with the middle, and then I will close with the key messages for today. Scientific collaborations can drive diplomacy, and diplomacy can drive scientific collaborations. I think we all know that, and I'll have a couple of examples. The world community recognizes that research is fundamental for human health. I think we can all buy into that. I'm going to tell you about the PAHO and WHO policies on research for health and how they support the creation and enhancement of robust systems of research for health. And talk a little bit the examples that Lois Cohen will talk about, how science built bridges between peoples, and then we'll follow up with some examples in the PAHO region, the Initiative for Caries Free Communities, as well as U.S. Latin America Cancer Network, and EVITNet, Evidence-Informed Policy Networks. That is one of the flagship initiatives for PAHO. Their scientific questions can drive cross-border scientific collaborations, and diplomatic needs can drive scientific collaborations. There was a Middle Eastern cancer consortium that was formed when I was still at the National Cancer Institute many years ago that's still ongoing, and actually is an example of diplomatic needs driving the science. An example of the science driving scientific collaborations, there's no better example, I think, than the sequencing of the human genome, which not only drove scientific collaborations in its sequencing, but also in its sequelae, which are things like the genome-wide association studies that are going on. I see that research is fundamental for human health. Trust me, I'm not going to go over all these various things that went on, or meetings, reports, etc. There's three of them. The strategy on research for health, that is a WHO strategy. The policy on research for health, which is the Pan American Health Organization, the PAHO policy, and the global strategy and plan of action on public health, innovation, and intellectual property rights. Those are three initiatives, or three policies that are active in 2009. The one that has actually been approved by the governing bodies for PAHO has been the PAHO one, and the global strategy has been approved by WHO. The WHO strategy on research for health is on the dock to be approved very shortly. These are the policies, goals, and objectives. Basically, effective information and knowledge systems and dissemination plans. They all support that. They all support that there be clear national and regional research agendas and policy. All support human resources, a capable research workforce. We heard much about this in various meetings that I have been participating in the Global Forum. Strong regulatory frameworks and structures, well-equipped research institutions, and adequate financial resources. All of those, I think, are, interestingly enough, all of those are attributes and that contribute to the establishment and strengthening of research systems for health. Brief analysis on these, and if you look at the upper left-hand side of the slide, the strategy, the global strategy, and the policy. And what you find is that they all support basically the attributes, the information, knowledge, communication systems, having a clear national policy, human resources, etc. All of those support having a research system for health. Some examples in the PAHO region, Lois, would you?
Examples I'd like to address there are just many to choose from. The one I know most about is the first one, strengthening oral health systems, an initiative that was taken by the World Health Organization, of which PAHO was a part. This historically began in the 70s and was originally initiated when the U.S. was just, trying to discuss the options for national health program under President Nixon. There were clear tensions between our country and the countries behind, quote, the Iron Curtain. And clearly that research, where the U.S. had the need to know, and the head of oral health at WHO was a Russian, this was a perfect opportunity to get together and to bring mutual needs from both sides together. And in fact, 10 nations began to collaborate with a common research protocol to study their own systems and to look between and among systems for structural features of nationally developed oral health systems, measuring effectiveness and efficiency. Now, on the basis of that, PAHO now has initiated a major new program, new activity in the entire region, from Canada all the way down to Argentina. And in April, there was a workshop that dealt with launching this new initiative for caries-free community that evolved from the body of research that was done over the many years by bringing together all the nations, identifying the most vulnerable populations in their nations that are susceptible to caries, try to identify those communities using common protocols, and launching demonstration research to affect that. And if we go to a member state that is collaborating in the region, PAHO has also been involved, as the U.S. National Cancer Institute is taking a lead role. The U.S. Sorry, I should show you the slide. U.S. Latin American Cancer Research Network, which is an initiative that connects at the government and at the investigator levels. It has several goals of understanding the disease burden in cancer research and care infrastructure, promoting partnerships across the entire research continuum, from basic biomedical research all the way through application clinical studies and outreach, and building collaborative relationships to sustain those initiatives. I will now turn it over to Norka to tie it.
So what I want to talk about now is PAHO's, excuse me for the acronym, the Pan American Health Organization's flagship, one of their flagship initiatives, which is the Evidence-Informed Policy Network, which is basically, it seeks to bring scientific evidence to the table when policymakers are making policy. So it brings in a number of activities. In the first phase of putting together this initiative, basically a team has to be built, and that team has to include members of the policymaking community, as well as members of the research community, academicians, civil society, etc. So it really does bring together a number of stakeholders. It has to be resourced adequately. And then, as in a second phase, it enhances linkages between producers and users of evidence. As one of the key outputs of this EvidNet, it leads to the commissioning, updating, and use and assessment and adapting of systematic reviews in the production of what we call policy briefs, basically a communication device to bridge the communication gap between the policymakers, folks in the Ministry of Health, and other stakeholders in the policymaking community, and the academic community, which produces the research. The point that I'd like to leave you with is that EvidNet is a catalyst. Basically what EvidNet does in providing the reliable and trustworthy evidence is it touches upon all the various components of a robust system for health. Human resources. Basically the point is that it basically touches upon all the various components of a system for health. And so in that way, it really is a catalyst for a health system, particularly health system for research. This is my last slide. Sciences are common language. Research leads to health, leads to harmony, and on and around. I had this one time this animated with the dancers dancing, but we'll skip that part. Thank you.
Dimension of global health diplomacy, one that particularly health brings to the table, the inclusion of science, and I think the word science diplomacy is something that is also coming to the fore increasingly.